All right, ladies and gentlemen. I mean, the numbers are climbing. Let's go ahead and keep pushing it to 100. But without further ado, we've been producing a flyer so that we can make sure everybody knows about this amazing program of 7K Healthcare. That's one of the benefits of the membership. And I spoke with Scott Ferdulis, who's the president of that company, and he wasn't able to make it. He had an emergency that came up, but he called me on last night and told me that he had a gentleman that could definitely fill in his shoes. I remember years ago there used to be a interesting commercial about Shell Oil, and that was a gentleman that was on there. They called him the Shell Answer Man because he had all the answers to the question. Well, this gentleman holds that same title with the healthcare program, Mr. Joe Maley. His background is very unique. I mean, just the first part, he's a follower of Christ. So he's already number one in my book. He's a husband and dad to two girls. He's a network marketing veteran of 13 years, health insurance arena for 4 years. And he's been with the 7K Health since its inception. He is the sales manager for the FMA program, and he leads the phone team for 7K Health. So most of the time when you call in here, here's the guy that's going to get you in the right direction. So help me welcome to the Zoom, my man, Mr. Joel Maley. Take it away, sir.
Thanks so much, Tony. And I want to do a quick mic check here. Can everyone hear me okay?
Yes, sir. Loud and clear.
Outstanding. Well, that was an excellent wealth strategy presentation. And thank you all for including me on that. And Tony, it was great to chat with you yesterday and this morning as well. And, when Mr. Joseph was talking earlier, talking about offense and defense. And, I am a member of 7K Metals as well. And I was just soaking that up. I mean, what an excellent way to think about this. And, I look at the healthcare side of things, health insurance, as part of that defensive strategy. So in the bullion world, gold and silver, that is a defense, right? Well, this too, the number one cause of bankruptcy in our country is unexpected catastrophic health expenses. And so we already know this, but in addition to 7K Metals, 7K Health is just helping you add to that defensive wealth strategy. So thank you, Mr. Joseph and Mr. Tony again. All right, my friends. Yeah, a lot of you on here, I've actually seen a lot of names that I'm familiar with because you're already members of the healthcare. Maybe some of you recognize my voice because I do take a lot of the phone calls. I lead the phone team. And so there's a number of us that answer the phones. However, I do a lot of it myself too. So, thanks for being here. Thanks for inviting me on. And what I'd like to quickly do, this stuff comes pretty naturally to me and it all makes sense to me. And I realize, however, that health insurance is a topic that can be pretty confusing. And so please forgive me if I breeze over topics that make sense to me. I'm going to do exactly what Tony said. I'm going to do my best to reduce it to the ridiculous, which I love, Tony. That's a great phrase. And I'm going to go ahead and steal that if you don't mind. And so my job over the last 4 years or so has been to do just that, to simplify these concepts. But I also love the fact that when 7K Health was created, the idea was the defensive strategy and also to provide a solution for people because healthcare is expensive and it's getting more expensive by the second, it feels like. And to offer people a way, I was just reading some of the testimonials. People are saving hundreds of dollars a month. Some families are saving over $1,000 a month on just their premiums alone. So what a great way to put some money back in your pocket. Maybe you can use that for a trip with 7K or, back into auto savers or, just to put it back in the family budget, right? So what I'm going to do quickly today is cover a few things. Remember, this meeting is being recorded. So ideally you can reach out to Tony and get a copy if you need more, but also key takeaway, if I bore you to death with details on the health plans, we do have videos, and I'm going to follow up with Tony after this to make sure that he has the videos and therefore can distribute them to folks who need them. And so these are video overviews of each of the plans. That way people can rewatch or pause and rewind and get a better understanding, or even share those with prospects, right? Hey, I know the value of gold and silver is there, but did you know also we have access to some huge healthcare savings as well as a part of this membership? So I'm going to dive in. I'm going to share my screen. And once again, I'm going to talk briefly about each of our main programs. And then I'll talk a little bit about what does the process look like? If you're a member, what does the process look like of evaluating healthcare plans? How do you get your questions answered, and how do you enroll? And then I'll open it up for Q&A at the end. So thanks for bearing with me through the housekeeping stuff. And I'm going to go ahead and share my screen. In fact, what I'd like to do first is just talk quickly about, let's share here. Here we go. Let's do the advanced share so we can just do the part of the screen. Here we go. All right, so what y'all should be seeing is 7khealth.com here in the top and in the address bar. Is everybody seeing that? There's a family riding bikes. Okay.
Yes, you can see
Okay,
it.
awesome.
Thank you.
Yes, thank you so much. So here's what 7khealth.com looks like. And the way you get here, you can just type in 7khealth.com, right? You can also, in your member back office, and under the dashboard, you can click on member benefits, and then you scroll down a little ways, 7K Health, click on it there, and then it'll redirect you to this page. And so what I'm about to show you is a couple of the brochures. So the key part of this website here is this menu bar. And these are going to be kind of where you start and navigate through finding about the plans. You can look at the summary, which is a quick little one-pager document on each of the plans, or you can download the brochure. And what I'm about to show you is the brochure. So let me switch over to, let's talk about the Atlas Health Plans. Is everyone seeing the Atlas Health Plans here? Okay, no objections. So here we go. So Atlas Health Plans is one of the options as a member of 7K that you are able to purchase and be covered by you and your family, all right? So the first thing you'll notice about the Atlas Health Plans is that there are 4 options, and they're shown in the columns here: primary care, basic health, enhanced health, and supreme health. And so in keeping with Mr. Joseph's example of offensive and defensive strategies, I would say that primary care and basic health are more of the offensive strategy type plans. And the reason why is because they're plans that'll help you save some costs when you're going out and you need to use things like telemedicine. You need to use things like primary care specialists or urgent care visits. These 2 plans are going to help you do that, and help you do that at a good price. Okay. Whereas the enhanced and the supreme health are the ones that are going to have that, plus the defensive strategy of, holy cow, I have a big catastrophic situation. I'm hospitalized. I need a surgery. I need a whatever. And now I'm staring at a whole bunch of medical bills in the face. The enhanced and the supreme health are going to help you shore up those costs and protect you from catastrophic expenditures. They're gonna help you out there. So let me explain once again, guys. There's a lot to cover in a little time, and we have videos, so never fear. Primary care plan is the first sort of foot in the door access to some sort of healthcare savings. What it comes with is a network access. However, you need to start with the telemedicine. Okay, so on the primary care, what you have is a 24/7, 365 telemedicine line that is $0 charge. Now, let me tell you, all 4 plans have that 24/7, 365 telemedicine at a $0 copay, so no cost to you. Okay, when you make the visit, and you can make as many visits as you want. I used this 7 days ago. And I am a huge advocate now for telemedicine, because I woke up with some stomach pain on Sunday morning of last week. And, I'm thinking I'm drinking herbal tea and trying to get it to go away. And it just kind of got worse. And I'm thinking, well, maybe I have a stomach bug or something. And maybe I can, get rid of my stomach contents and that'll give me some relief. However, it never got to that point. It never felt like I needed to throw up. So finally, 4.5 hours later, after I woke up, it's getting pretty intense, and I called telemedicine. And he asked me a couple questions and see if it's related to a stomach bug or a virus or something. And right before he got the call, he goes, "Well, what's your pain level?" And I said, "It's 7 or 8." And he said, "Oh, okay. In that case, you need to find yourself in an urgent care." So I did that. I went to the urgent care. So the moral of the story is this. I mean, the rest of the story I'll give you guys, but the key piece is, man, it was easy to call. And that doctor, so I called up, and a couple, a lady asked me a couple, generic questions. And then she's like, "Okay, a doctor will call you within 45 minutes. I hung up, the phone rang, and it was the doctor. So I was like, okay, that was super awesome and super fast. And I'll tell you, I probably would not have taken myself in had I not gotten recommended by a professional to go in. Like, "Hey, dude, like, yeah, you need to go in." I'm kind of that type of person that's like, "Yeah, it's not that bad, right? Like, yeah, I can get over it. It'll be fine." Well, turns out with appendicitis, you don't want to put that off too long because it can turn into real bad real fast. And some of you may have a personal testimony with that. I do, as of 7 days ago. So I went to the urgent care. Urgent care doctor goes, "Yeah, you need to go to get a CT scan because we can't rule out appendicitis. So you better go find yourself at an ER." Once again, I would not have taken myself into the ER unless I was recommended to do that. And so I did. Turns out I had appendicitis, and the surgeon was on his way an hour later. So I am very grateful for telemedicine. And in fact, the whole process works, right? And we're about to be on the enhanced plan as a company. Right now, we have a different plan that has this telemedicine piece. We're getting ready to go over the enhanced plan. So, little story to show you that this stuff is helpful. This stuff works. And by the way, 7 out of 10 times you call up to telemedicine, they're going to have an option or solution, maybe call in a prescription for you. 7 out of 10 times, a person, when they call in, does not need a follow-up visit. So that's a huge asset to all these plans. So with the primary care plan, moving on, primary care plan, it does have that telemedicine piece. And if you need a primary care office visit and you start with telemedicine, they can refer you to go in at a $25 copay. And same with urgent care. They can refer you to go in at a $50 copay. And as you can imagine, this plan is a pretty low cost because it's limited in what it offers. After the telemedicine and the primary care and urgent care visits, there's not much else that's covered. You do get a pharmacy savings card, and you can see the pricing right here for primary care plan is very low, $119 a month for member only. Okay. And you'll see $245 a month there for a family. All right. So that's foot in the door access to healthcare. Moving on to the next plan. Once again, I am going to open it up for questions at the end, so never fear. Basic health is the next step up. Why? Well, this plan has 100% coverage for all ACA mandated services. And ACA stands for Affordable Care Act. There's a whole list of things that are required by the ACA to be covered 100%. And this basic health plan fulfills that. So we're talking basic stuff like annual physicals covered 100%, mammograms, colonoscopies after a certain age, any immunization schedule for your children or wellness visit, anything that's related as preventative, the plan covers 100%. Okay. And then that is now true for basic health as well as the next 2 steps up plans. All of them have the telemedicine. All of them have 3 virtual behavioral health consultations for no charge. So that's more like a mental health or a therapy related visit, a virtual visit. Okay. The basic health has unlimited primary care in-office visits for a $35 copay. Now, remember, there's a network. So it is one of the, if not the largest PPO networks in the country. It's the PHCS, Practitioner and Ancillary Network. And it's extensive. So if by some crazy chance that you don't have any in-network providers within a 50-mile radius of where you're at, most people do, then you can pick one and the plan will treat it as if they are in network. All right. So pretty awesome benefit there as far as finding in-network practitioners and providers. $35 copay, unlimited primary care visits. Specialist now has a $75 copay. And that's things like, cardiologist, right? Or orthopedist or dermatologist. Okay. Urgent care, $50 copay, unlimited visits. All right. And now the basic health has some additional benefits here in the lab services, $150 per panel. Radiology like x-rays, major radiology like MRIs or CT scans, like your boy here did on Sunday last week. Man, that was a crazy experience. I'll tell you more about it if you guys ask. It's just nuts. But I'm better now. I'm on the mend. And that's about it. Okay, so after the major imaging services on the basic health plan, you do have actually a $75 copay here is what this means for outpatient mental and behavioral health and substance abuse. So you can actually go see a mental health professional and have that as a $75 copay. It says refer to in-office visit at specialist. So it's a $75 copay for that as well. So basic health plan is quite a bit of a step up in terms of what you're getting. And therefore, you're also getting 100% coverage on ACA mandated prescriptions. So zero cost to you. And you do get that same deep discount retail savings pharmacy RX card on the basic health plan. And you'll see the rates here. Doesn't matter if you're 18, doesn't matter if you're 64. The basic health plan is the same cost price to you. Member only would pay this, $235 and 34 cents. And a family would pay this. All right. Okay. So moving on to the enhanced health plan. I'm going to speed up a little bit here, I think, because I do want to touch on the MyShare plan, which is a very different alternative plan option after this, as well as show you one or two tricks on the 7K Health website that'll super make your life easy when it comes to deciding which plan is right for you and your family. So enhanced health plan now is the first plan that has hospitalization benefit to it. Okay. And so once again, here's a defensive strategy because God forbid one of us needs to visit the ER, me on Sunday. Now we have an ER benefit. Now we have a hospital benefit, and we have something in place to protect us from catastrophic expenses related to accidents or illnesses or whatever, or appendicitis. Enhanced health plan. Okay. These plans are very unique, and track with me here. They have a $0 deductible. So most of us are familiar with the term deductible. What that means is it's the amount that you pay out of your pocket for healthcare expenses before the plan begins to pay anything or help you out at all. Now, these plans have zero for a deductible, which means the plan begins paying and helping you out from the very beginning. So this is very, very unique. Okay, very unique. Most plans that you're gonna be familiar with, whether it's an employer plan or marketplace plan, you're gonna have some sort of deductible. And a lot of people feel like, man, I pay my premiums all year long, and then I got to pay $5,000 worth of a deductible before the plan helps out. Why am I paying anything? Why do I even have a plan? And so now, of course, if you're stuck with $70,000 worth of hospital bills because you're hospitalized for 7 or 8 days, that's when your health plan makes a lot of sense, right? But these plans have no deductible. So how cool is that? So what that means is down here on a primary care visit, the copay is all you'll pay. And the same is true on the basic health plan. $35 copay is all you pay. You see, on a deductible plan, the copay is just one of the things you pay, and you will get a bill later in the mail with the in-office services performed. And you're responsible for that up to your deductible. Not so on these plans. This plan, you pay $25 for a primary care office visit. Boom, plan pays 100% of the bill. You'll pay a $50 copay for a specialist and a $50 copay for urgent care. Plan pays 100% of the bill. This starts to get really exciting down here in the ER visits. Okay, and this is one per person per plan year. This is what the limits mean, and I'll touch on those in a second as well. That you just pay $350. So we know that ER can cost, a couple grand or more. Well, this plan is you're just paying $350 for a visit to the ER, and the plan pays 100% of the bill. Okay, how incredible is that? That's shoring up your expenses big time, and really protecting you from having to pay too much. All right, and so that's how the copays work on this plan. When you see a copay, that's all you're going to pay for that service. And the plan will cover 100%. Now, let's say, God forbid, you need a second visit to the ER in the same year. Well, what happens then is your money on that expense, your cost, your medical expenses, you will pay. Of course, you'll pay a discounted rate because you're a part of the plan, you're a part of the network, etc. But that then goes toward your out-of-pocket maximum. All right. And then once you reach an out-of-pocket maximum on these plans, again, the plan will cover services, covered services on the plan are covered 100%. Okay. So I hope that makes sense. I kind of beat that like a dead horse because I get a lot of questions about that. But once again, urgent care visits, $50 is all you'll pay for the first 2 per family member. And then after that, you're going to pay the full bill minus the discounts. And that goes towards your out-of-pocket max amount. After your out-of-pocket max, plan covers 100%. Okay. So super low copays. And you know what? The Supreme Health Plan is very close to the same as the enhanced. Big differences are the out-of-pocket maximum amount is much lower on the Supreme Health. And therefore also there's a maternity benefit. Everything else is very close to the same. Maternity benefit on the Supreme Health Plan, you pay a $350 copay for the doctor for the professional services and a $350 copay for the delivery. Okay. Which is an amazing benefit. And then, you know, a couple differences are the copays are slightly even smaller on the Supreme Health Plan. And you get 1 or 2 more visits until your money goes toward the out-of-pocket maximum after you've used up those visits. Okay. So key takeaways, there's no deductible on these plans. Hopefully you go all year long and you use maybe 1 or 2 doctor's visits and maybe use an urgent care visit or 2 because, you know, your daughter got sick and with the flu and she had a high fever. Again, personal experience, right? And, you know, you only have $50 copay or a $35 copay actually on the Supreme plan, $50 copay on the enhanced. Okay. So I'm going to switch gears really fast. Again, here's the pricing. You guys can see all this on the website. I'm gonna actually real quick on the pricing. A lot of my folks that I've talked to, 7K members, are on this enhanced or on the Supreme plan, and I know I'm not going to name names, but I know one family was paying. They were paying actually $2,100 a month for their family plan. And so they looked at the Supreme plan like, yeah, we're going to take that. They're saving $900 or more a month on their monthly premiums. Imagine what you could do with that $900 a month back in your budget, right? I mean, imagine, that's awesome. And so I just want to share that quickly. Now shifting gears to the MyShare plan. I'm going to go through this one very fast because I'm running out of time. And once again, I'll get you the videos, so never fear. The MyShare plan is, let me just tell you this. So this plan is more for the person who is more concerned with, hey, I'm not so much as concerned about doctor's visits, maybe urgent care visits, you know, ACA stuff like preventative colonoscopies, preventative mammograms. I'm not so much as concerned with that type of stuff. What I really care about is, I'll pay a little bit more for all that stuff. That's fine with me. I'm more concerned with the catastrophic incident, something super bad happens and one of us is hospitalized and they need a major surgery or whatever. I don't want to have to pay a whole bunch of money. The MyShare plan does a better job, I think, in that regard, whereas the Atlas plans do a better job with the super great coverage for the day-to-day stuff, primary care, urgent care specialist, and a great job with the catastrophic stuff as well. But that plan's going to cost a little bit more per month, whereas this plan is going to save a person a little bit more monthly because, the day-to-day stuff is going to cost a little bit more. You're going to pay out of pocket a little bit more. And something bad happens, it does a better job catastrophically. And I can explain that further if we like, but these plans are very unique and very different. So MyShare is a package, okay? So it actually contains 3 pieces all bundled together to make one excellent healthcare product. And the 3 pieces are member benefits. You actually become a member of the plan, which is an association benefit through Business Workers of America. You get additionally, you get insured benefits. So there are some insurance benefits with this plan as well, which is called indemnity insurance. And then there are some shareable benefits as well, which is a health share program. Some of you might be familiar with health shares. They are this health share does the catastrophic portion of the plan, and it does an excellent job in the realm of catastrophic costs. So like I said, not going to dive into a whole lot of details on that, but what I do want to share about this plan is I had a friend who said a super wise quote. Okay, take this and use it, write it down. He said, when it comes to your health, you will either pay now or pay later, but you're going to pay. And if you pay later, it could cost you your life. So I'll repeat this. He said, when it comes to your health, you'll either pay now or you'll pay later. And if you pay later, it could cost you your life. And so what he meant by that, one of the things he meant by that, it's such a profound statement because there's a lot to it. One of the things he meant by that was you can take the time, effort, and energy and expense to live healthy, to live a healthier lifestyle right now. And you pay with your time, you pay with your energy, you pay with your effort, you pay with your money, maybe healthier foods, maybe a diet plan, maybe exercise and maybe coaches in those areas, right? However, if you choose to pay later, not do those things now, and you pay later, that could cost you your life because you neglected, and now you're looking at expenses, right? Hospital expenses, emergency surgery expenses, maybe even the expense of your life because you neglected your health, right? So either pay now and pay later. And I wanted to share that with you because I think about healthcare that's kind of similar. You're either going to pay now for a plan, but sometimes the more expensive plans are more expensive because they cover more, right? And so you'll either pay now or you'll pay later, and you could wait for the big expense. And if you're not paying for well, here's the takeaway: if you're not paying for any health insurance at all, you could pay later, and it could really cost you, right? It could really cost you if you don't have some sort of health insurance in place. And that's why MyShare exists. That's why Atlas exists, is to help you do a good pay now so that you don't have to pay later. All right. So I hope that makes sense. Got on a little tangent rabbit trail there. Hopefully that was valuable for you guys. With this plan, I'm going to send you guys the video on it. It does a better job explaining it. It's a very unique plan. Key takeaways about it are it works in Hawaii. The other plans, the Atlas plans, do not. So it's a good one for Hawaii, and I saw some Hawaii folks on the call today. Additionally, the pricing on this plan, monthly pricing, is lower, okay, in most regards than the Atlas plans. And then the other key takeaway on this plan is you do have more access to providers because there's no network, so to speak. So a person can go with the other plan, it's a PHCS network. And those are your providers. Again, super huge network, extensive. With this plan, there's no network. You can go see somebody, you can go see anybody really, because what they're doing is they're negotiating down the price of anyone you go see. So you actually have an advocacy team that negotiates those expenses for you on your behalf. Once again, you're going to pay a little bit more, but it is discounted down, and you do have more of an open access to see a provider. Okay. And so that's one of the benefits of the MyShare plan. So I'm right at about 30 minutes, y'all. So I am going to take 2 minutes to show you the website here, and then I'm going to turn it over to questions. And I'm going to see if anybody fell asleep, because health insurance makes sense to me. And I hope nobody fell asleep. But here's the website. The key things, again, are going to be these tabs. I want you to see the rates tab. Here's the process, okay? I told you I was going to tell you about the process. The process is this. You're a member of 7K Metals. That's step one. Step two, well, my healthcare is super expensive. Let's see what 7K Health has to offer. So you're going to go here to this website. And I want you to do this research before you call. We love taking your calls. However, the volume sometimes is overwhelming. And if you don't get somebody on the phone, leave a voicemail message on our line. We will call you back. So please leave a message if you don't get somebody. But before you call, make sure you've done your due diligence, because a lot of these can be answered on the website here. Here's the rates tab. Okay, you can see the Atlas Health Plan rates. Click on it. It'll show you the rate sheet I just showed you. Additionally, you can see the MyShare rates right here. We do have supplemental plan options like just a telemedicine plan, as well as a pet health plan, which is a savings plan, virtual care plan. And we additionally also have a vision plan right now. We're working on dental. That's the number one question I get right now is dental. When's it going to be available? Coming soon. Okay. It's we're hoping within the next 30 to maybe 45 days. There's a lot that has to happen. And these things take time. However, it is coming. So never fear. Okay. Rates tab, check out your rates. Okay. Brochures tab, you can download the full brochure, which is what I just showed you. And then the health plan summaries tab, which will just give you the summary in a one pager, which is very helpful. Okay. So that's where you want to start. Please do these things before you call. Secondly, you can search for a provider. If you want an Atlas plan, this section here, this little button, you scroll down on the page a little bit. This is how you search for providers in the Atlas plan. And these steps are very important. So before you click the link, which is the whole box, you want to read these steps so you know what to do when you get there. All right. And so again, this is all research you can do on your own here. You can click the link. It's going to take you to a website. You're going to have to click select network. Then you're going to have to click PHCS. Then you're going to click select our practitioner and ancillary. Then you do your search. Okay. Very important steps. So don't forget that. All right. And then another question I get a lot of is, when's the V series going to be ready? Okay. V series isn't ready just yet. So ignore it for now. It's coming. However, it's not ready yet. So for now, focus on the Atlas Health plans and the MyShare plan. Okay. And when you are ready to enroll, you've decided which plan is best for you. No further questions. You can enroll here. Enroll now. Select the plan that you want to enroll in, and this will take you right over to the enrollment site. Okay. As long as you're a 7K Health member, and I'm going to open it up for questions. As long as you're a 7K Health member, just use the, how do I stop the share here? Here we go. Just use the same email address as your email that you use for your 7K Metals account. So use the same email address when you sign up for the healthcare. It'll ask you for that in the enrollment section. And make sure that your first and last name is the same as your 7K Metals account as well. So those two things are going to be the key to 7K Metals knowing what to do with you when they see you are active in the healthcare. Okay. So thank you guys so much. I think I took 2 or 3 extra minutes. However, Tony was very generous in giving me 30 minutes of time. So thank you guys so much. And at this point in time, I'm happy to answer some questions. Keep in mind, I am going to send you those videos, and I think they will be very, very helpful to you as well. So, Sally Mary, do we have any questions? Okay, Sally Mary has questions.
Yeah, I do. It's just the one I wrote in the chat.
Awesome. I see them. Okay, so someone able to help members decide the best, better healthcare plan to be on. Absolutely. So that's what the phone line is for. So the phone line is at the bottom of the website I just showed you. 7khealth.com. At the very bottom, you'll see the phone number. That's 7K Health. That's the team that I lead up, and we are able to answer your questions and help you decide. Secondly, Sally Mary asks, is it open enrollment? Great question. You can enroll at any point in time. And so therefore you do not need to wait till November, December, January. All right. You can enroll any given month of the year. Also keep in mind too, that your existing health plan, they're 9 times out of 10, they have not locked you into a contract. You don't need to stay on that until you fulfilled your year. Okay. You can stop paying premiums to them, and then you will not have healthcare with them anymore. And so you can quit that. And there's no harm doing that. And these plans you can enroll any given month. If you enroll by the 25th of the month, you can have your plan start on the 1st of the following month. Okay, so enroll by the 25th, plan begins on the 1st. Okay. Number 3, do you or do any of the current plans include vision? They do not include vision. If you were to need like a surgery on your eyes or something, the plans have like surgery coverage, right? But if you need like coverage for exams, contacts, glasses, things like that, you would want the vision plan. And you can add that in when you go to enroll in one of the Atlas or the MyShare plans. You can add the vision on, and it's very inexpensive. Okay. Thank you, Susan. Great feedback from you. Thank you. Appreciate it. Sandy, is the vision available now? Yes, it is. Yes, it is. And you can just buy it by yourself if you want. You got some medical plan somewhere else, you're happy with it, fantastic, but you need vision, go on and purchase the vision. You can do that. Okay. How do the points? Okay, so points is not my area of expertise. In fact,
I'll do that on the points.
Mm-hmm.
If an individual buys the plan, when they pay their premium, 7K gives you 15 points. So if they're on your team, it's the same as them buying one of the 115 options on the deal. If they buy the family plan or premium, whenever they pay their premium, you get 20 points. Okay. And that's how that points every single month that they're on there. So that's another reason why you want to, not only will it give them a better option more times than not, but again, that counts towards your residual income. So
awesome. Thank you, Tony. Yeah. So that's great. Doesn't matter what level of membership. Yes. So you'll need to either be a 199 member or a 599 member.
And I see Tim McCray put a good question out there, but do me a favor before you answer that question. Everyone, put a 10 in the chat if you thoroughly enjoyed this training and it was very helpful and it's something you're looking at becoming a part of here at 7K Healthcare, including myself. So put a 10 in the chat if you saw value in everything Mr. Joel Maley brought to the table today.
Wow. Awesome. 10, 10, 10, 10, 10. Thank you, guys. Thank you. Awesome.
Okay, Tim McCray, why don't you unmute yourself, man, and ask that question that you have.
Okay, Tim. Okay, Tim, if you're in a place to unmute, go ahead. If not, I see your question in the chat. It says, what about pharmacy benefits? Is that what you're referring to, Tony?
No, I thought he said something else. It might have been for me. Yeah, that's him. That's him. Go ahead, Tim.
Sorry about that. The screen jumped off and I couldn't reach the unmute button.
Okay.
Yeah, I was just asking how to check what the formulary is for pharmacy benefits. I've changed healthcare plans before specifically to get a medication that was very expensive, and it was on the list. And then once I paid them a few $1,000s in premiums, I found out they were going to pre-auth me and deny my coverage for the medication that I came to them for. So how do you check things like that? First of all, if a medication is covered, and second of all, if they're really going to pay for it, because, previous experience is that they'll try and not pay you if they can.
Yeah, good question. So, yeah, totally good question. So pharmacy benefits wise, the pharmacy benefit is actually consistent with all of the plans. So now the Atlas plan is the one exception. It's the same pharmacy benefit in terms of the discount. However, if you're on Enhanced or if you're on Supreme, you do have some plan benefits there that they're paying for additional. If it's a tier 1, 2, or 3 medication, the Atlas plan is going to pay towards that, and you're just going to have a copay, and you'll see those tiers on the summary that we just covered. However, the discount portion of the plan is consistent on all of the plans, including MyShare, Atlas, and any of the pharmacy supplemental plans like the 24-hour virtual care plan. And this website actually here is going to be a resource for you to check your medications. Full disclosure, okay, if you're on a higher cost medication, like a higher cost maintenance medication, meaning like $400 or $500 a month or greater, these plans may not be the right fit for you. Full disclosure, because those super expensive medications, there is an advocacy program built into the plans that they're going to help you, alternative mail order or international mail order or They may even, work with a doctor and see if they can maybe recommend a generic version that does the same thing, and they'll help you do their best to discount that drug for you. However, once again, you can look these things up, and this is the website right here. So it's going to actually bring you over to this website where you want to use you can locate the pharmacies here, but you can also use the price estimator. And the price estimator, you can actually type in the name of a drug, and I'm just going to type in some random letters here and see what comes up. So now look at all these things that come up. So you can type in whatever you're looking at, and type in the quantity, type in your zip code, and even expand the radius and price it, and it will show you the price of your prescription. Okay. And so that is right on the 7K Health website, 7khealth.com homepage. Scroll down right here, find a pharmacy. Okay. And you can
that's great. Well, thank you for being so honest and clear about that. That's great information. It's not unexpected, so I appreciate that. And also you pointed right to where I can check. It's very easy to check and find out what's available and so on. So that's what I wanted. Thank you.
My pleasure, Tim. Thanks so much. Great question. Great question. Tony, how much more time do you want to take for questions, if any?
We'll just go through the questions, because I'm just going to do a short training after you finish. So I want everyone to get their questions answered. So
outstanding.
So if you got a question, go ahead and unmute yourself, and because chances are other people have the same question. So let's go ahead and do that, because again, I want to make sure everyone gets full value out of having my man, Mr. Joel, with us today. All right, Sandy Terry, you're unmuted. Go ahead.
Hello, I'm curious about the vision. Is that for a single person, or is that for the family, and how does that work as far as routine exams with your eye doctor and stuff?
So great question. And for full details, you can visit the brochure. Quick overview: the vision plan can be for an individual and or family. So there's two price points. Individual, it's $23.98 a month. Family is any more than, so you and a spouse, or you and a child, or you and your spouse and your 7 children, right? It's just member only price and a family price. Member only price is $23.98. Family price is $48. Okay, so $48 for a family. And what that allows you to do, again, brief overview, is have as many eye exams in a year's time for just a $10 copay. So as many eye exams as you need. You have full coverage on medically necessary contacts. Okay, and that's medically necessary by your provider. Hey, you need these things because you're legally blind or whatever. I don't know. I have good eyes. I'm blessed with good eyes, so I don't know how they do that. But full coverage on contacts, full coverage on eyeglass lenses and frames after a $25 copay. All right. So pretty good coverage as far as I understand it. Again, I don't know a lot about the vision world. And then you can see the details on that brochures tab. You download the vision brochure. That plan is a standalone plan. And the reason it's a standalone plan is because it comes also with additional member benefits. So what you're going to see on that brochure are member benefits like similar to 7K Advantage, actually, where you're getting discounts on emergency preparedness supplies, personal protective equipment, and other things like that, in addition to the group vision plan. So you'll want to scroll through that brochure and find the benefits for the vision. Did that answer your question?
Okay. Yes, it did. Is there a certain provider list that's in network, or?
Good question. It is the VSP Choice Network. Okay, so VSP Choice Network, and you'll be able to search that network of providers. As far as I understand, VSP is the name brand when it comes to provider networks in the vision world, and that's the network you want to search.
Joel, you said V as in Victor, B as in boy?
V as in Victor, S as in Sam, P as in Paul.
Absolutely. Appreciate that.
Yep.
Thank you so very much. I'm so excited about that.
You're welcome, Sandy. Thanks for your
Anyone
question.
else, raise your hand and we'll allow you to unmute. All right, David Eismer. I guess I said that right.
Yeah, Asmir, Tony. That's
Asmir,
fine.
okay.
You know,
That sounds like a little French right there. Go on with it. Go on with it.
it's all good. It's all good. Hey, Joel, great presentation. Real quick about dental. I didn't hear a whole lot about the dental. Is it offered in any one of the plans? Addition to?
Yeah, great question, David. So the dental plan will be a standalone plan. It's not on the website yet because it's not available just yet. So none of the plans have it included. There is the 24-hour virtual care plan, which we didn't touch on a whole lot, does have a dental discount in there. So it offers like 10, 15, 20% discounts on certain cases at in-network dental providers for basic things like teeth cleanings, right? And stuff like that. And you can see that on the 24-hour virtual care plan. However, remember, that's not insurance, okay? It's a discount. And that's the 24-hour virtual care plan. As far as dental insurance, David, it's coming soon. So they're working on that plan, and we're hoping to have that hopefully within the next 30 to 45 days. When we do have it available, you will see it on the website, and you'll be able to enroll in it at that time.
Outstanding. Thank you so much, Joel. I appreciate it. You have a blessed rest of your day.
I appreciate it. You too, David. Thank you. And I just want to read Emily's comment here. She goes, "Thanks, Joel. Sign me up again." So that's awesome.
Emily is the main reason that he got it over there in Hawaii, man. I mean, they already had paradise, but now they got some healthcare on top of that.
Exactly. That's right.
All right, Ramona, the floor is yours.
Hello, everybody. Thank you for this wonderful presentation.
Thanks,
I
Ramona.
actually have a question as to how familiar you are working with military TRICARE.
Good question. Is there more to that question?
Well, yes, just in the concept, I'm a spouse
Okay,
with lifelong TRICARE benefits,
sure.
but
Okay.
I don't have access to the VA, etc. My
Okay.
husband does.
Okay. Yeah.
Would there be any reason I would get this? Because I know, go ahead. I'll let you just try and answer what question I kind of asked.
Yeah, it's great. It's a great question. And I've dealt with it a little bit. I'm not going to pretend to be an expert in that world. From my experience though, TRICARE is going to be something you want to stick with. From what I've heard from folks, it's a pretty good monthly price, and it does have some pretty extensive coverage and benefits. So without knowing your specific benefits between your spouse and yourself, certainly call in. We can chat about that. But 9 times out of 10, TRICARE is going to be the better bet for you.
All right.
Yeah, I'll never give up TRICARE. Oh, sorry, I didn't mean to interrupt. I'll never give up TRICARE.
Yeah.
But I just didn't know if supplementing.
Yeah.
And somebody's been chatting with me privately, and I agree, but I just didn't know how much experience you guys have with TRICARE, because TRICARE, it's U.S. government.
Right.
They always want to pay last.
Right.
So you guys would be paying first.
Yeah. Yeah. So there, there would be a coordination of benefits. If there was something that you found was lacking in your TRICARE coverage, that you felt that 7K Health, one of the plans, does a better job of, you could certainly get a plan, and they would coordinate benefits. So if there were, like you said, if there's something lacking that you felt we did a better job of, you could get on the plan, and the two would coordinate.
Thank you.
You're welcome. Great question. But
All
yeah,
right.
call in if you want to touch on that more.
Anyone else?
Vision. Okay.
Okay, Sally Mary. Sally Mary got a lot of answers, just so you know, Joe. Sally Mary got a lot of answers. She's
Thank you, Sally Mary. Okay.
So she knows about that TRICARE there. So.
Awesome. Awesome.
Anyone else before we wrap it up? All right. So before we, I'm gonna take about 15 to 20 minutes to just do a little training today on how to give an effective testimonial, which is critical to your success here at 7K Metals. But before we do this, ladies and gentlemen, let's all there's a hand clap emoji in there. If you would, let's give my man a round of applause. I really appreciate everything Joel brought in. Oh yeah, they clapping for you, man.
Thank you guys. I appreciate it. Yeah. Thanks for your time. And Tony, thanks for inviting me on. I really appreciate it.
Appreciate you. And I look forward to doing this again. Because again, you know, a lot of times people don't know what they don't know. And when they get a chance to hear that, they can actually do better. And not only will it be beneficial for you, but it'll also be beneficial for your team. So again, appreciate your time, Joel. I mean, on a Saturday, man. And I look forward to our next conversation, man.
Well, it's my pleasure again. And hey, go Big Red today.
All right, good deal. All right, ladies and gentlemen, for the next 10 to 15 minutes, I'm going to do some training. And I hope you guys are in a position where you can take some copious notes. I'm going to do some training about one of the things that's critical. And the faster you learn this part of your business, the more effective you will be as far as growing a bigger team. And that's how to tell your testimony. Okay, so I want hopefully each and every one of you guys in a position where you can take some copious notes. Because this is something that's critical to your success. I'm going to tell you about the psychology behind it, as far as giving you an effective testimonial. And one of the things I learned, you know, in my 19 years in this space, is that if you're going to be successful in network marketing, you don't have to be great. What you need is a story. Okay, I want you guys to write that down. If you're going to be successful, make full-time income, 6-figure, 7-figure, 8-figure your income, you don't have to be great. What you need to do is have a story, okay? And each and every one of you that are on here today, you have a story to tell. Now, I want you to understand something, is that one of the things I'm oftentimes encouraging entrepreneurs with is this, is that, and one of the things I want you to get, if you're on this Zoom today, is that the moment you sign on the dotted line here at 7K Metals, you were good enough. I need you to get that today. The moment you sign on the dotted line, you were good enough. But in order for you to do something that you've never done, you're going to have to become somebody that you never become. So you're going to have to learn the nuances on what I need to do to be successful in network marketing. And one of the things that's critical that you need to learn early on, it doesn't take 3 years to do this. It don't take 5 years to do this. I mean, from the very beginning, actually in your first month, you need to learn how to tell your story, okay? You need to learn how to tell your story. And you're going to be amazed as how many people that you can attract to your reality that are already within your sphere of influence that will at least take a look at what you're doing if they know your story, okay? And here's what I want you to understand. This is one book I encourage all of you guys to get. One of my favorite authors is a gentleman by the name of Simon Sinek. It's Simonsinek. And he wrote his most famous book. It's called Start with Why, W-H-Y, Start with Why. And in that book, he talks about the major reasons why people that know you, love you, and trust you, the major reasons why they get in business with you is this. People don't buy what you do, they buy why you do it. I want you to write that down. People don't buy what you do, they buy why you do it, okay? And so as a leader, when you're first coming on board, you need to get good at telling your story, because people don't buy what you do, they buy why you do it. The people that know, love, and trust you, if you want more of those people to come on board, all you got to do is get good at telling your story on why you decided that 7K Metals was the business of choice. People don't buy what you do, they buy why you do it. Why did you decide that 7K Metals has to work for you? Many of you know my story. You know, when I got involved in 7K, I was recruited to be one of the first reps because of my success in another gold and silver company. But you oftentimes hear me say, the reason why I joined 7K Metals, because I had come to a point in my life, because of my condition, of my family and everything else, this has to work for me. I mean, it was non-negotiable. The reason why I dived right into this bill, and I've been full-time in this space for the last 11 years, I mean, I came to the conclusion, this has to work for me. And I got real good at telling my story. And of the 400 and some people that I recruited in 7K Metals in 6.5 years, the majority of them came on, the ones that were in my warm market, because they knew my story, why I decided to become a part of 7K Metals. Now, I'm going to give you the psychology behind it, okay? And the reason why it's so powerful that each and every one of you learn how to tell a 30-second story how to tell a 1-minute story, and how to tell a 3 to 5 minute story. The reason why it's so powerful, because here's the thing. If you notice, every time we do a presentation, the first thing we begin at, we don't tell the company story, we tell our story. Why? Because from a psychology standpoint, I need you guys to write this down. From a psychology standpoint, the first thing a new prospect is you invite to a Zoom, and they see a Joseph Latin, they see an Emily Manuel, they see a Jason Shirley, they see you on it, they see a Darryl Steele. The first question they have in their mind, and you have to answer it emphatically yes, is this. When they see you on that Zoom, because they don't know you from Adam, the first 2 questions they have in their mind is this: who is this person and why should I listen to them? You need to write that down. I'm telling you the psychology behind how to build an effective business and how to tell the right kind of story. The first 2 questions, your prospect, everybody you invite to a Zoom, everybody you bring to a home meeting, everybody you bring to a restaurant, a hotel meeting, here's the first 2 questions in their mind. When they see the first person get up there to talk about the business, their mind is this: who is this person and why should I listen to them? Okay, that's why you need to be able to tell your story. Because when you tell your story from your perspective on why you decided to do this business, more and more people say, hey, listen, I can give this person 20 minutes of my time because I know their story. I can give this person an hour of my time because I know their story. People don't buy what you do, they buy why you do it. So you got to get good at telling your story. And every last one of us on the Zoom today, we have a story to tell. But you want to know how to package that story so you get the most bang for the buck. The reason why you're seeing me more and more doing the presentation, inviting different ones, because there are people that can relate to Joseph Latin that can't relate to me. There are people that can relate to me that can't relate to Joseph Latin. There's people that can't relate to me or Joseph, but they can relate to somebody telling their story on why they decided to make 7K Metals their choice. And so here's the thing on telling the story. An effective story in network marketing has 4 parts, and I want you to write that down. And this is something I learned from going to the Eric Warray GoPro Recruiting Mastery in 2013 and 2014, when I was with my first gold and silver company. I took a group of 20, and I took a group of 30 of my top leaders so we can go out there and learn from $1 million plus a year earners in network marketing. And so one of the things they taught us about is how to tell an effective story. So an effective story in network marketing has 4 parts, and I want you to write this down. And I want you to practice your story. So if someone asks you to do your story on a 3-way call, if someone asks to know your story on a Zoom presentation, because I want to be able to utilize each and every one of you, because every last one of you have a story, you want to make sure it's a story you want to tell. All right, so an effective story in network marketing has 4 parts. Number 1, you have to have the background. Where did you come from? What did you do prior to getting started with 7K? We all have a background, okay? So number 1, you want to tell your background. Number 2, what you didn't like about your background. If you were working a 9 to 5, what you didn't like. And I promise you, they say as much as 80% in corporate America hate what they do for a living. So I know there's something you did not like about whatever you were doing for a living at that time. So number 1, what is your background? Number 2, what you didn't like about it that triggered you to look for something else to either supplement or replace it. Number 3, why you got started. Why you started and your current situation. And then number 4, your future. Where do you see yourself going? Okay. Let me say that again. Number 1 is the background. Number 2, what you didn't like about it. Number 3, why you started. And number 4, your future. All right, where do you see yourself going? All right, and every last one of you guys can get real good at. You need to have a 30-second one, a minute one, and then a 3 to 5 minute story. Because if you notice, every time you hear us do a presentation, from a psychology standpoint, I will tell my story. In the next couple of weeks, we'll do a training on how to do an effective presentation. Because an effective presentation, there are 3 questions that in that new prospect's mind that will move them to action to be a part of what you're doing. Those 3 questions is this. Number 1, does it work? Number 2, can I do it? And number 3, will you help me? Okay, we'll do that at a different time. But I want you to understand, there is a method to the madness. We don't just tell a story for any reason. We know how effective a story is in network marketing. I mean, and you need to understand how to package your story so it gives the most bang for the buck. There are a lot of people that come to a presentation like this. They don't get started because that was an awesome presentation. They get started because they can relate to that person's story when they hear that testimonial of that person. And you know what comes up in their mind? Me too. I mean, you heard Kim talk about how Miss Kim Wilhunt, you heard her talk about, because of the pandemic, there are millions of people that shifted, that looked for a plan B because of how their business or whatever they were doing was effective during the pandemic, in 2020. It caused a lot of people to shift. A lot of people recognize the fact that even in network marketing, that they were not in a pandemic-proof business. There were a lot of companies that went down and went out of business because of the pandemic. And then there were some that thrived. Because we have a pandemic-proof business, which we didn't even know that existed 6.5 years ago, our company doubled and tripled during the pandemic. And most companies don't have that story, okay? But it's so important for you to know your story. And one of the most famous quotes as far as the story is concerned was the great Winston Churchill. He said, history will be kind to me because I intend to write it. And once you recognize your story, your goal as a leader is to always make your story better. So how do I make my story better in 7K Metals? By becoming a copper, by becoming a gold, by becoming an executive in presidential gold. Winston Churchill said it. History will be kind to me because I intend to write it. And when it comes to your story, guess who the author of that story is? You. You can determine your story. I don't care what it is right now. I mean, you can go from 0 to hero, but you've got to be able to create that story. All right, so what are the 4 parts? Background first. Where did you come from? Now, because I've done more meetings in different cities in 6.5 years of 7K Metals, I looked at my calendar a few months ago. In 6.5 years, we've done meetings in over 100 different cities for 7K Metals, over 100 different cities. And what that has allowed me to do is to hear some incredible stories on why 7K Metals has to work for you. Some of the stories, and just give you an example so you can package your own story. I heard so many people that have been self-employed all their life. So their story, why they joined 7K Metals was this. They said, listen, because I've been self-employed most of my life, there is no 401k. There is no mutual fund. There's no pension plan. So the reason why I joined 7K Metals, because this is my 401k. This is my mutual fund. This is my pension plan. This is why 7K Metals has to work for me. Some of you, again, and your story should wipe away any excuse why people should not do this business. If people try to tell you they're too young, I tell about Miss Stelly, who was 18 years old and became a gold associate. If they say they're too old, I mean, I oftentimes remind them of the famous quote of George Eliot, who said, it's never too late to be what you might have been. And then I tell them Joe Preston's story, the young 86 who was 84 when she joined 7K Metals, who's constantly cashing checks at 7K Metals. Okay, I tell her story. So not only do you want to package your story, but you want to get good at memorizing other people's story so I can share. So when people try to give me an excuse, I'm too young, I talk about Miss Stelly. Okay, 18 years old, a gold associate when she was in college, making more than her professors. Okay, when they tell me they're too old, hey, I have a senior rep, 86, and she's not even the most senior rep. I have a gentleman that lives here in Houston that is 98 years young, is an associate, and makes a couple thousand a year in 7K metals. All right. And the reason why I package that and I pull it out when necessary, because I know the power of a story. People don't buy what you do, they buy why you do it. Some of you, your story is this. You know, I was a single mom. You know, I mean, I was in a dead-end job. You know, I mean, I wasn't going anywhere. And the reason why I got involved with 7K metals, I saw an end. I saw a light at the end of the tunnel. I saw people that were doing this that were younger than me, older than me. And I started initially just to collect some gold and silver, but I started earning part-time. I cannot tell you how many people now are earning full-time and life-changing income because their story changed in the process. People don't buy what you do, they buy why you do it. So an effective story is this: your background. Where did you come from? What were you doing prior to 7K metals? Number two, what you didn't like about it. I was a school teacher, one of the most honorable professions in the world. But put a 2 in the chat if you believe that school teachers don't get paid nowhere near enough for what they do, developing young minds. Put a 2 in the chat if you agree with me that for what they do, they should all be making at least a 6-figure income. Put a 2 in the chat. And just so you guys know, the profession that on average has the most success in network marketing are school teachers and coaches. Just so you guys know. Those are the numbers in any network marketing company around the world. All right, because they know how to teach a system. All right. But how many school teachers come on board because although they love what they do, they're not making enough money. I don't know any teacher that's making enough money for what they do, for all the headaches they got to put up with, for all the verbal abuse, because the school system, in a sense, works against them for what they do. And so many of them come on board because although they love what they do, put a 3 in the chat if you would love what you do more if you made more money. If you were a school teacher making $50,000 a year, and then you make an extra $30,000 in 7K metals, put a 3 in the chat if you would love, you'd be skipping the school because you ain't got to worry about bills and stuff like that. Create that story, ladies and gentlemen. So an effective story, again, your background, where did you go? And we all have a beginning. What did you do prior? You guys know the reason why I got involved in network marketing. I mean, I have been approached for years, you know, probably 30, 40 different times before I ever got involved in network marketing. I was 36 years old when I first got involved in network marketing. And I've been approached for years, but it was not 12 o'clock in my life. Okay. And there are a lot of people, if you approach them and tell them your story, it's 12 o'clock in their life. This is what they've been praying for. This is what they've been hoping for. All right. But you got to tell your story because you'll be amazed at how many people will just take a look at it if they know your story. I was an operator at a chemical plant. The last 10 years I worked there, I was making 130 to 150,000 a year. And I was in the 90s and the early 2000s. So I was making good money. At the time, the most I ever made in my life. But the reason why I got involved, because I saw what happened in that merger. I saw the people that had been there 20 years, 30 years, and their lives were destroyed. So the reason why I got involved, because I did not want my family to be subject to somebody else making a decision on whether or not my family could eat. That was my story. And when I left the chemical plant, I had a slew of people that was at the chemical plant that joined me because they knew, I mean, he had to have his hands up on something to walk away from this. I had a slew of them that joined me while I was there because they saw the layoffs. And my story to the people, if you only have a 9 to 5, you are what is called a volunteer victim because it's not a matter of if, it is a matter of when. So my story is that I got involved initially because I didn't want, I knew I needed some type of plan B, but it eventually became my plan A. But that was my story. So people can relate because there's a ton of people out there that have been laid off or they've seen the effects of being people laid off. So that's my background. Some of you, your story was you might have been in a bad situation and you didn't even have the money to get started. Tell your story. So when people say, you know, I don't have the money, tell the story of somebody who also didn't have the money, but they recognized the fact that if they didn't come up with the money, 5 years from now, they was going to be in the same situation. So they made a sacrifice, they borrowed, whatever the case may be, to get involved. But that's their story. So number one, the background. Number two, what you didn't like about what you were doing. What did you didn't like about the school teacher? They didn't pay you enough. What I didn't like about the chemical field, it was a dangerous environment. In 14 years, we get exposed to stuff that, oh yeah, by the way, that was a carcinogen. In the 14 years I worked out there were 8 people that died, okay? 8 people that died. There were many times my wife, because she heard about some of the incidents and explosions and stuff, she didn't know if her husband was coming home. So it was a dangerous environment. So although it was good money, you know, I mean, it's a beautiful thing to have financial freedom through Never Mark. I mean, I just say that, okay? So what you didn't like about it, I never liked graveyards. They told me I would get used to them. 14 years later, I still hated graveyards just as much as when I first got started. We worked 12-hour graveyards, rotating shifts. And at 2 o'clock in the morning, I cannot tell you how many times my mind tells me, said, man, what are you doing? You're walking around at 2 o'clock in the morning. What's wrong with you? Okay, so that was certain things I did not like about my job. All right. Why did I get started? I got started because of a layoff. You know, why did you get started? Tell your story. Some of you would just want to get some additional revenue. You understand the value of multiple streams of income. And then last but not least, your future. Where do you see yourself going? Where do you see yourself going? Okay. And the beautiful thing I love about this space, and you heard me say it a couple of times during the presentation today, is that the beautiful thing about in this network marketing space, I don't have to beg somebody after a year sitting across the desk, can I have a 2% raise? I'm a grown man. What I need to be sitting across the table, I'm nearly 60 years old. I'll be 60 next year. What do I look like sitting across the table hoping that somebody else give me a 3% raise? Give me a 5% raise. The reason why I love this business, one of the reasons why I love this business, at any given time, I can give myself a raise. You got it, Emily. At any given time. If I don't like what I'm making, I can go out there, use the skill sets, the mindset, what I've developed over the years, and give myself a raise. And you can do the exact same thing. So that being said, I'm done for now. But again, if you don't know how to tell your story, get with someone. I know there was a training one time that Zach Davis, he's one of the best trainers I've ever seen on it. It trains on how to package your story so it's effective. If you had a presentation and somebody's doing it for you, and then you tell your story and that moves that person to action. I think Zach David had a training on there. I don't know if it's still on there about how to package your story. But and if it is on there on doing the training, you definitely want to get that part. But if anybody got any questions, comments, add 2 takeaways before we wrap it up today. Oh yeah, also building your story. In fact, I got that book right there by Blake. And actually Blake and Zach actually recommended first, but yeah, Blake did too. By building your story, building your story brand. Okay, good deal, Emily. All right, so anybody else got any questions, comments, add 2 takeaways before we let you go? The floor is open. Raise your hand. I see M over there in Paradise. You got anything you want to put some icing on the cake?
I got nothing.
Y'all get ready for that event over there.
I got a fireplace over here, fresh coffee in the lobby. Let me turn I don't know if I can turn my screen around from here, but yeah, I should be able to hear. So there's like coffee up in the lobby area here. I'm sitting right outside.
That's y'all doing a My Way event this weekend, right?
Today is Big Island.
Oh, Big Island. Okay, Big Island. Okay.
Yeah, and then I fly to Big Island today, and then I fly back to Kauai for a couple days, and then I fly to Oahu. Then I stay there, and then I fly over to Maui.
Okay, so Maui is next Saturday then.
Yeah.
Okay, good.
Exactly. Yep. So if you guys have anybody, send them over. Today we're in Hilo, 10 a.m. Wednesday, 4:30 event in the evening for Honolulu, and then Super Saturday on Maui is at noon this next Saturday. So if you guys got anybody in Hawaii and you want to tap them in, you better start inviting them now before I invite them.
All right, and in a couple of weeks we have the next event here in what they call the mainland, Emily, the mainland.
Oh, the mainland? What is that?
Matter of fact, Joseph Ladden, if you can pull up the flyer for the Charlotte event, I'll be there. Mr. Ray Patterson is the host. Also, Chris Ladden, Mr. Darrell Steele. And then we're going to do a financial summit on that Friday. We have an evening and then a noon session, then a after dinner session as well on that part. And then the weekend after that, at the end of the month, and we'll share that flyer. We'll be doing one right here in Houston. Several leaders, Chris Ladden, and as well as Mr. Scott Zuckerman will be coming to Houston for the end of the month, for the 28th to the 30th. So, but for those of you that are within a few hundred miles of Charlotte, you want to make sure you plug into that event. That'll be a Thursday, Friday, and Saturday. Thursday night, I'll be doing myself and Chris will be doing a wealth strategy presentation at a restaurant. That Friday, we have the financial summit, which will be 1 to 4. And then also in the evening from 6 to 9, where Mr. Ray Patterson, Mr. Kerry Morris, these gentlemen that are experts in trust, different types of not only how to make the money, but how to keep the money, will be there. And Ray Patterson, who is a CFA, Chartered Financial Analyst, he's over a fund that he manages over 75 million for some clients. So there'll be some great financial information on that. And then, of course, that Saturday will be a Super Saturday. So you definitely want to miss that. And then on that Friday as well, I'll be set up in that hotel doing one-on-one presentations from 9 to 5, every hour on the hour. And that'll be for either if you got prospects you want to bring by, or if you want to have coaching, one-on-one coaching, we'll be doing that from 9 to 5 every hour on the hour. And then the following the following week, we'll be doing the same thing here in Houston, and we'll share that flyer with you guys on Monday night. So that being said, ladies and gentlemen, everyone know this is the cutoff. This is the closeout at Saturday midnight Mountain Time. Looking at the report today, there are 1,000 of you that with a little push, you can make that extra 500, that extra 1,000, up to 12,500. So, and we'll be making it that Zoom available. Sally Mary, you want to tell you where we're gonna have that posted at for everybody who wants a copy of the Zoom today?
If they just go to your leadership page, it will be, and subscribe to your newsletter, then you'll get a copy. I'll do it that way so that you don't have to get bombarded with all the questions. So just go to Tony Hubbard Leadership. So I'll type it in the chat, https://www.TonyHubbard. Or you could just go TonyHubbardLeadership.com, but I will type it in here so it's an easy click. Let's see if
While she's typing that in, Tony, I did want to share a story, if that's cool.
Sure.
So I know she just dropped it in the chat. Thank you so much, Sally Mary. I wanted to share a story. And when we were down the river, we asked the guide, if someone falls off the raft and they fall off, the kayaks, how do we get them back in the boat, and how do we save them so we can help participate in the rescue? And and she gave a tip, and she said, you have to grab their life vest. And when you grab their life vest, you got to dunk them down in the water. Keep dunking, Matiba. So you dunk them under the water, and you count 3 times so that you can have that momentum, like dunk, dunk, dunk. And then what happens is the life vest, because it's buoyant, when you dunk them, it pops that person back up with the momentum, and then you can drag them into the boat a lot faster
Oh,
and
wow.
easier. And the weight of a person, like a Timothy Schmalbeck, they say he weighs about 50 pounds in water, which I think is a lie. But,
Oh, wow.
but the moral of the story is sometimes you're going to have a leader that's going to come that wants to help rescue you. And they're going to grab onto your life vest. And it's going to seem like they're dunking you and they're trying to drown you. And they're putting you in an uncomfortable situation. But what they're trying to do is they're trying to actually help you. They're trying to save you by teaching you skills or ways to be able to help you get yourself into that boat. And the reason I share that story is sometimes life, business, things that are going on, it just seems like it's drowning you, and it's going to feel like you're underwater, and it's going to feel like every single time it's pushing you under that rapid. But in reality, all of those things that are happening in your life, they are a test, they are a lesson, they will teach you, it'll help you grow, it'll help you be better, it'll teach you how to handle different situations, it'll teach you how to help, it'll teach you how to participate in your own rescue, and it'll help you trust the friend that is bringing you into the raft. And so thank you so much, Tony.
Oh man, that's a good one right there. Em. That's a good one right there. Emily over there dunking people. Okay, over there dunking people. Okay.
John has a new name now because he's been dunking people in the river. So his new name is John the Baptist.
I love it. I love it.
We saved a lot of lives in the water.
I love it. All right, ladies and gentlemen, listen, for the guests that are on here today, get back with the person who invited you out. And always remember that life is not about waiting for the rain to stop. It's about learning how to dance in the rain. Everyone have a great evening. God bless. We'll see you guys over the top. Take care.